Welcome to The Explainer. We've pulled some incredibly precise historical data from the archives today to map out what is honestly a beautifully cinematic story, the medical evolution of Sri Lanka. We're going to travel all the way from the ancient monastic hospitals carved into mountainsides centuries ago, right through to the cutting-edge surgical miracles of the 21st century. It's a sweeping narrative of profound resilience, massive public demand, and just sheer unstoppable scientific progress. We're anchoring our entire documentary theme today on Isaac Newton's famous idea of standing on the shoulders of giants. The Sri Lankan Medical Association, whose incredibly detailed historical records we are drawing from, uses this exact sentiment to honor the nation's brave medical pioneers. You see, the health landscape that Sri Lankans enjoy today, it absolutely wasn't built overnight. It was built on the tireless sacrifices of generations of doctors, nurses, and public health officials who went up against some truly unimaginable challenges. So here is our roadmap. We'll explore the roots and colonial epidemics, the dawn of independence and free healthcare, triumphs in maternal health, modern surgical breakthroughs, and finally, the modern NCD challenge. Part 1. Roots and Colonial Epidemics. To really understand the present, we've got to look at the past. Now, ancient Sri Lanka actually had a highly sophisticated system of monastic hospitals. There are even records indicating King Ponda Kabaya built lying-in homes as early as the 4th century BC. But the colonial era? That brought an entirely new, completely devastating set of challenges. When the British took control, they initially set up medical departments strictly for their own military troops. Eventually, though, a civil medical department was formed in 1858. Institutions like the Victoria Memorial Eye Hospital represent that early brick-and-mortar foundation of Western allopathic medicine laid down in the 19th century. But while that infrastructure was slowly growing, the broader population was suffering immensely. The island experienced what can really only be called a dark era of epidemics. We're talking about terrifying, widespread outbreaks of smallpox, cholera, malaria, and parangi, which you might know as yaws. The sudden rise of the plantation economy completely disrupted traditional village life and local irrigation systems, which directly led to famine. Add in the appalling crowded living conditions of immigrant plantation laborers and terrible urban sanitation, and you basically had a recipe for total disaster. Just to give you an idea of the scale, in 1866 alone, a single cholera epidemic wiped out 10,000 people just in the Jaffna Peninsula. It was a time defined by deep fear and astronomical mortality rates. Part 2. Independence and free healthcare. All right, the narrative shifts dramatically as we enter the 20th century. We move out of this period of despair and into one of profound hope and progress with the dawn of Sri Lankan independence in 1948. Contrasting those grim colonial health crises is what is now globally celebrated as Sri Lanka's health miracle. So you're probably wondering, how did a developing nation achieve this? Well, it wasn't just medical science, it was public policy. In 1931, Sri Lanka was granted universal franchise. Suddenly, politicians actually had to answer to the rural voting public. This immense public pressure drove the creation of massive, sweeping welfare policies, most notably free education and free healthcare, provided directly at the point of delivery. Part 3. Triumphs in Maternal Health. Nowhere is the success of these free public health policies more astonishing than right here. Okay, let this number sink in for a second. In 1948, the maternal mortality rate was 1,700 deaths per 100,000 live births. By 2012, that number plummeted to just over 32. This is without a doubt one of the most stunning public health victories anywhere in the developing world. Literally thousands upon thousands of mothers' lives were saved. So how exactly did they pull off this miracle? It wasn't by accident. It was achieved through a highly structured, community-based continuum of care. The whole thing really kicked off with a health unit system, first established in Kalatara in 1926. They sent highly trained public health midwives out across the entire island. When you combine that massive grassroots outreach with free hospital access and absolutely skyrocketing female literacy rates, thanks to that free education we talked about, you empowered women to actively seek out quality, life-saving maternity care. It was a total game changer. Part 4. Modern surgical breakthroughs. As that public health infrastructure matured and effectively conquered so many of those infectious diseases, the focus of Sri Lankan medicine really began to expand. We see a rapid sequence of modern medical milestones showing exactly how local medicine caught up with the developed world. In 1953, the first cardiothoracic unit opened its doors in Colombo. By 2002, the first IVF baby was born on the island.
Fast forward to 2010, the very first Sri Lankan genome was fully sequenced. And in 2017, an intense, grueling 9-hour surgery in Kandy marked the nation's first successful heart transplant.
But I want to zoom in on a specific, really inspiring micro-narrative here. The very first kidney transplant in 1985. Back in the late 70s, local doctors noticed this heartbreaking trend where patients with end-stage renal disease had to literally flee to India or Europe just to get treatment. Refusing to accept that status quo, pioneers like Professor Rizvi Sharif stepped up and set up the very first dialysis center in 1980. From there, a massive multidisciplinary team of surgeons, microbiologists, and technicians united. They risked their own professional reputations in an era of super limited resources, and they successfully pulled off that bold first transplant. They proved, beyond a shadow of a doubt, exactly what local medical capabilities could achieve. Part 5. The Modern NCD Challenge. Now, those pioneers absolutely conquered the impossible. But today, the healthcare system is facing an entirely different kind of enemy. To understand it, we need to talk about a crucial concept, the epidemiological transition. Because Sri Lanka's free healthcare was so wildly successful, life expectancy soared to nearly 75 years. But this very success, combined with rapid urbanization, means the population's disease burden has totally shifted. The primary threat is no longer malaria or cholera. It's chronic, non-communicable diseases, or NCDs, driven largely by lifestyle changes. The hard data behind this new crisis is honestly pretty stark. NCDs like cardiovascular disease, diabetes, and cancer consumed a staggering 35% of the total health expenditure back in 2013. We are seeing a massive nutritional transition, where Western diets, which are heavily loaded with saturated fats and refined sugars, alongside increasingly sedentary habits, are driving up obesity rates. And here's the real kicker. Because these chronic diseases often strike right during midlife and require lifelong medication, they severely impair workforce productivity. They're threatening to strain the free healthcare system to its absolute limits. The deep history we have been exploring today is meticulously preserved by institutions like the Sri Lanka Medical Association. And look, they didn't just compile this history as some dusty record of the past. They built it as a textbook of inspiration. It ensures that the doctors of tomorrow can look back at exactly how their predecessors defeated cholera and halved maternal mortality, and actually draw courage from those victories for the battles ahead. Which brings us to our final thought. Sri Lanka has continuously defied the odds to protect the health of its people. But as this rising tide of lifestyle diseases threatens the very foundation of the system, how must tomorrow's medical pioneers evolve this historic health miracle? What is the next chapter of this remarkable story going to look like as they fight to conquer the complex challenges of the 21st century? Thank you so much for joining me on this explainer. Keep questioning, keep learning, and I'll catch you next time.